Welcome, everyone. Thank you for joining Continuous Learning with Bioguard. It is my honor to introduce our webinar speaker, Dr. Anastasia Hanny Irawan. Dr. Anastasia holds a DVN and a master's degree in Vaccinology and Immunotherapy from Universitas Erlangga, Indonesia, with expertise in microbiology and parasitology. She also has experience in small animal practice and completed a research internship at National Zhongxin University, Taiwan. Currently, she serves as a technical specialist at Bioguard Corporation, Taiwan. Rabies is a fatal viral disease that attacks the central nervous systems of mammals, claiming 70,000 lives globally each year. Transmitted primarily through the bite of an infected animal, this virus poses a significant public health challenge. In today's webinar, Dr. Anna will explore cutting-edge diagnostic techniques, insight into disease pathogenesis, practical methods for early detection, and essential protocols for rabies control in clinical practice. Without further ado, please join me in welcoming Dr. Anna.
Thank you, Dr. Robert, for the kind introduction. So I will share my screen. Dr. Robert, can you see my screen?
Yes.
Okay, so hello everyone, my name is Dr. Anna, and today I will talk about how to master rabies diagnosis and detection and what every vet must know about this disease. So rabies has been known to humans for at least 4,000 years ago. It is one of the oldest known disease, and it is dating back from ancient Mesopotamia, where Babylonians had to pay a fine if their dog transmit rabies into another person. So for example, if their dog bit another dog or another person, the owner have to pay a fine. And it also has been recorded in writings in the tablets of Egyptians dating back to 2300 BC. So because this disease is very ancient, it has been known to humans for a long time. And one of the clinical signs is a rabid animal. So in the Latin, the word rabies comes from the word madness in Latin. And Lyssa means violent in Greek. So even the Greek people, thousands of years ago, already have a name for this disease. And the etiology of rabies, it came from the family Rhabdoviridae, and the genus is Lyssavirus, and the full name of this species is Rabies Lyssavirus. So we will talk a bit about the rabies history. So for thousands and thousands of years, this disease is very deadly. It's like unstoppable. And it becomes a fear for everyone, not only for animals, but also for humans. But on the 1880s, a French chemistry teacher and professor named Louis Pasteur, this is the man on the picture, maybe you have ever heard of him before. He is also known as the father of microbiology. And if you ever heard of pasteurization on milk, like pasteurized milk, he is also one of the founder of the way how to pasteurize milk. So this man was doing also research on fall cholera, which is also virus in birds and in poultry, in chicken. Then when he was researching, he found out a way on how to make an attenuated strain. So attenuated strain meaning a weak strain. So he tried to grow this virus in rabbits, and then he take out the affected nerve tissue and drying it. So he did this attenuating or weakening virus in other viruses too. So besides fall cholera, he also did it on anthrax. If you have ever heard of anthrax, it's also very deadly disease. So he wants to try it on rabies. But then the problem is that he is not a human physician. He's not a doctor. So when he made this so-called like first type of vaccine, he cannot try it on humans. He can only try it on other animals. But then one day, a 9-year-old boy named Joseph Meister was mauled by a rabid dog. So he was bitten by a rabid dog on his leg. And then his parents brought this boy to various doctors, various physicians, and then all of them say that, oh, I'm sorry, but your boy is incurable. Your boy will die. Until one day, one of the doctors told the boy's parents to go and see Louis Pasteur. And then Louis Pasteur, with the help of some doctors, helped to treat Joseph with the first rabies vaccines. And Joseph then received 13 inoculations in 11 days. And then he made a complete recovery. So this man, Louis Pasteur, is also one of the reasons why we have the modern vaccine that we have right now. So next we will talk about the rabies viral structure. The rabies viral structure, as we can see here, rabies is a very ancient virus. So the structure is actually very simple. It has this bullet shape, and then it have a single strand negative envelope RNA virus. So because it's an RNA virus, it only have a single strand. And then because it's a simple virus, it only consists of two parts, which is the viral envelope and the ribonucleocapsid core. Now, we can also see that because the structure is very simple, it only consists of 5 proteins. The first one is the nucleoprotein, which codes the RNA. Second one is the phosphoprotein, and it's inside here, and it do the regulatory function with the matrix protein, also inside here. And then on the outer layer of the envelope, here we have the glycoprotein. And the glycoprotein is the important protein for the neuroinvasiveness. So this is one of the most important protein in rabies. And last but not least, we also have the large structural protein here on, which is responsible for the RNA replicase for the mononegavirus type. Next, we will talk about the Lyssavirus serotype and genotype. So the Lyssavirus genus is divided into 4 serotypes. And the rabies virus that we know is in the serotype 1. And then on the serotype 2, we have Lagos bat virus. which infects the mammals on the southern and central part of Africa. And it has its names, Lagos, because it was isolated from a fruit bat from Lagos Island. And on serotype 3, we have the Mokola virus. This Mokola virus infects mammals on the sub-Saharan Africa, and it gets its name, Mokola, from the Mokola forest in Nigeria. And then in Nigeria, it had the first human victim in South Africa, which died after bitten by a bat. And on serotype 4, yes, the Diefenbach virus is also on bats in South Africa. So all of this Lyssavirus genus is usually found in bats. And then after further classification on all of these serotypes, then there are 7 genotypes, which is besides all those 4, we have the European bat Lyssavirus, which is prevalent in countries like Spain, the Netherlands, and also Russia, and European bat Lyssavirus 2, which is prevalent in Great Britain. And then on genotype 7, last but not least, this is a very special genotype because the rabies virus is not present in Australia, but Australia have this Australian bat Lyssavirus, and it is the only Lyssavirus in Australia. And this is just found recently in New South Wales. And in Taiwan, there is also recently found a Taiwan bat Lyssavirus in 2018, but further research is still going through about that virus in Taiwan. So here we can see on this map, in this world map, is the countries or areas that is at risk of rabies. So we can see on the red color, it's mostly located in Africa and Asia. So in Asia, it is mostly found in India. So rabies is very, very high prevalent in India. And it has, I think, one of the highest rate of human rabies worldwide, up to, I think, 20,000 human deaths annually just in India. And this is because in India, there are a lot of stray dogs, and most of those dogs are vaccinated. Also in Africa is the second most prevalent, and about 24,000 deaths annually. So what is causing these 2 countries with high prevalence is because of the amount of stray animals, and also it's hard to get the vaccine in these areas because the vaccine will be costly in those areas. And other than that, on the low risk or rabies-free countries are in Australia. Australia doesn't have a case of rabies, and then New Zealand as well. And then some parts of Europe, North America, there are very little case of rabies. And in Asia, we have Japan, Taiwan, Hong Kong, and Macau. So rabies is endemic in almost every continent of the world, except Antarctica, because in Antarctica, the bats is not a native to Antarctica because obviously it's very, very cold there. So we will talk about the reservoir of rabies. The reservoir of reservoir animal for rabies are usually carnivores. And in different parts of the world, there are different carnivore host reservoirs for rabies. So for example, in Africa, besides dogs, they also have jackals and mongoose. And in Middle East and Asia, besides dogs, there are also wild animals such as red fox, ferret badgers, and golden jackals. In Europe, there are mostly just foxes and raccoons. And what's special is in North America, where the vaccination for dogs is very, very good. So usually the rabies in North America comes from either bats or raccoons, gray fox, striped skunk, and coyotes. So it's mostly because of the wild animals. And what's also special about the US is that because of the dog vaccination is so good, then they have less dog bite cases, and then they even have a higher cat rabies in the USA because apparently they don't vaccinate cats with rabies vaccine that much. And then on South America, where dogs are still like very prevalent, they also have raccoons, coyotes, and then crab-eating foxes and marmoset. And on the Arctic regions, there are usually foxes because like they're the ones who can withstand the cold winter there. So out of all carnivore host reservoirs, according to the WHO, domestic dogs is responsible for more than 90% of all human rabies fatalities worldwide. However, even though when we think about rabies, we always think about, oh, dogs, dog bites. But in contrary to what people usually believe, rabies virus can infect all mammals. So not just dogs, they can infect cats, they can infect horses, they also can even infect livestock such as cows or goats, even though not as much. And one of my own theory about why we always associate dogs is because of their own behavior. When dogs are threatened, the first thing that they do to protect themselves is bite. It's different with cats. Cats, when they feel threatened, you can see their defense mechanism. They will scratch first rather than bite. So usually the way that this disease transmits is that from bats, bats can get in contact with the wild animals such as foxes in the wild, and then those foxes will get in contact with our pets like dogs, because like I think in some places, in some countries, they have like a hunting dog. So the dog will have an interaction with these wild animals. And then if the dog gets bitten, then this dog might also get this disease and can transfer this disease to us humans. And vice versa, us humans can also transmit to like other animals. So that's why this rabies is called a zoonotic disease. So this virus spreads via saliva, usually through bites, scratches, or direct contact with mucosa, such as eyes, mouth, or open wounds. So why scratches? Because sometimes when the animal groom itself, it will lick their paw, and then when it lick their paw, their saliva is in their paw. So when they scratch, and the scratch causes a wound, then the virus in the saliva on the paw can enter into this wound. So other than that, the virus can also be found in the tears, brain, and nerve tissue of an infected animal. And besides this, there was also some cases reported that it can spread through organ transplant. I think there was a case of a human in China that got this disease through the organ transplant. And also, in the contrary of what people believe, rabies is actually not transmissible by blood, urine, feces, skunk spray, or intact skin, like direct contact. So if the infected animal is bleeding and we touch the blood, it's okay. We won't get the disease because we touch the blood. Also from urine, like for example, you have a dog and then it lick the urine or lick the feces of an infected animal, then your dog won't get infected by this. Also through skunk spray or like intact skin direct contact. Next, we will talk about the rabies incubation period. So after the bite of a rabid animal, the incubation period varies around 14 to 90 days, but it can also be considerably longer. And there are even some human cases that have been reported with exposure occurred around 2 to 7 years, even before showing clinical symptoms. So the human got bitten like 2 to 7 years ago. And then after 2 to 7 years, they start showing the clinical symptoms. There is also an incubation period of 2 years that has been reported in a cat. So these incubation periods, it is highly variable and it depends on some factors, such as the first one is the age of the individual bitten. So the younger the animal is, the immune system is not strong enough. It hasn't developed enough to fight the infection. So the younger the animal, the faster the incubation period is. Second one is the vaccination status. If the animal hasn't been vaccinated, they don't have enough antibody to fight this disease, this virus. So that's why if they don't get the vaccination, then the incubation period will be much, much shorter. Third one is the degree of innervation of the bite site. So as we all know that through the bite, the virus will enter. And then if the bite is not deep enough, then it might not enter deeply to the wound. And then if it not enter deeply to the wound, it will take time to go inside the nervous system. So if it's not that deep, that the incubation period might be longer because it needs time to multiply first in the muscle. The next one is the distance from the point of inoculation to the spinal cord of the brain. So, for example, in this one, if that a human gets bitten on the leg versus a human that is get bitten on the neck, then the human that gets bitten on the neck have a shorter distance from the neck to the spinal cord or the brain. And if it gets like a shorter distance, that means the incubation will also be shorter because it doesn't need to travel that much. And last but not least is the variant and amount of virus that is introduced. So the variant for right now, maybe you have ever heard of street virus, street rabies, and fixed virus or fixed rabies. So the street virus is the wild virus that we know, and the fixed virus is the kind of virus that has been made in the lab and it has been weakened, like attenuated. So the variant, if it's the wild virus, that means the incubation period will be shorter. And also if the amount of virus that enters our body is more virus, that means the incubation period will also be shorter. So next we will talk about the rabies pathogenesis. So for example, in this picture, a cat has been bitten by a raccoon, a wild animal that has rabies, and then the raccoon's saliva gets into the bite site. So in the saliva, there is the virus, and then the virus in the bite site will initially replicate in the muscle tissue, and then from there, it will enter a motor neuron endplate. So it will enter the nerve. And then it will multiply very rapidly in the nerve. And then the virus will like flows and goes into the peripheral motor neuron and then into the spinal cord neurons, where it will multiply more rapidly. And then from this spinal cord, it will travel out and continue upward into the brain. And the virus, when it was in the spinal cord, can cause lower motor neuron paralysis, which also cause the behavior changes. And then when it gets to the brain, it will also cause the more paralysis and then the cranial nerve deficits. So once it reaches into the brain, it will spread through the peripheral nerve and go into the salivary gland, or we call it the parotid gland. And from here, it also spreads into other various organs. So because the disease, the virus is like in the saliva, the animal can also transmit the virus into the saliva. And during the final stages of the clinical phase, after replication in the CNS, the rabies virus can be detected in almost all innervated organs. Next, we will talk about the clinical signs of rabies. So on the early stage of this disease, because when the disease enters our body, when a virus, a pathogen enters our body, it will show lethargy and fever, because our body is fighting this infection. So usually we will have a high fever. And then because this virus attacks the nerve system, then the dog will have some difficulty breathing or swallowing, even seizures and changes in behavior. And then when they get into difficulty breathing or swallowing, then the dog cannot eat, and then they will vomit, or they will also, because they don't eat, they lose weight, hence the anorexia. And other clinical signs are also excessive salivation, because their jaw is paralyzed, so their mouth keep opening, and then because their parotid gland is infected, then it will produce more saliva. Other clinical signs such as cerebral dysfunction, cranial nerve dysfunction, this all will cause ataxia. So like incoordination of the body, weakness, paralysis, and then coma, and eventually the animal will die. So the rabies is usually divided into 3 stages. The first stage is the prodromal stage. This stage usually occurs around 2 to 3 days after exposure to the disease. So after they get bitten or after they get scratched. So first thing that we can see is that there are some behavioral changes in this animal, such as anxiety, restlessness, or apprehension. So usually if your dog is like very calm, suddenly it becomes very restless, it goes anywhere, and then it gets very irritable. And they may even like suddenly snap or bite you. And then on the clinical signs in this stage is that there is a fever, a high fever, pruritus, which is itchiness in the bite site, and also paresthesia. Now, on the second form or second stage, which is the furious one. So on this stage is this stage that where we usually know or see the dog is very aggressive, very mean. So this stage, it lasts around 1 to 7 days. And the clinical and behavioral signs is that the dog have excessive crying, like suddenly they start like, oh, oh, and then it gets like loss of appetite. It doesn't want to eat anymore. Like usually your dog, when they see food, they wants to eat as much as possible. They're like usually food driven, but suddenly they don't want to eat anymore. And third one is that they're hyperactive. They keep pacing and circling, like in this picture, they circling, and then they may snap at imaginary objects or eat strange things, such as like, for example, their own feces, straw, sticks, and stones, because they're having this hallucination. And not, last but not least, they have a muscular incoordination and also seizures. They also have heightened sensitivities to visual and auditory stimuli. So at this stage, usually the dog will goes inside into a dark place and very quiet place on the room and just hide there. And they get very, very irritated to light. They don't want to see light. When you like give a flashlight to them, they will like growl. And at this stage, usually in humans are having a what they call a hydrophobia, or scared of water. And then on the last stage, which is the paralytic form, so usually when the animal is already at this stage, is the animal is unsavable. So this stage is occur around 7 days after the symptoms begin. And it is characterized by progressive paralysis starting in the hind limbs. So usually on their hind leg, their back leg, suddenly they cannot move it, and they can only move on the top half of their body. And then it will progress into difficulty swallowing because their throat and the jaw masseter muscles had the paralysis. So because of this, they will also cannot eat anymore, don't want to eat, don't want to drink. And then they will also have this excessive drooling and foaming on the mouth. And on this stage, usually the dog will go into a coma and then death within 3 days. So usually when the dog has passed, we will send the dog brain into the lab. And when you see in the lab, their brain, you will find gross findings like this. So you can see this brain has a it's very inflamed and have a lot of these congestions on the blood vessels in the sulci of the cerebral hemisphere. And then this is the when you see this in a dog, usually it means that they have rabies. And then when we make the brain into slides, we will see these histopathological findings. So what shows and what is the special findings in rabies is a Negri body. So what is a Negri body? Negri body is a cytoplasmic inclusion. So here in the picture A, you can see this dark circle. So this is the Negri body inside the neuron of a bobcat that is infected with rabies. And then on the picture B, you can also see this dark pink round thingy on the cytoplasm of the neuron of a camel that is infected with rabies. Other than Negri bodies, there are also perivascular cuffing. So we can see here, like if we zoom in this brain, you can see that there was like the congestion of the blood vessels. And this is the blood vessel. And around this blood vessel in the brain, you can see there are a lot of mononuclear cells, which is the lymphocyte and macrophages. So this dark blue color dots around the blood vessels. So this is called a perivascular cuffing. So next, as vets, we need to find a differential diagnosis. When we want to diagnose a disease, we always need to have a differential diagnosis. So here are some differential diagnoses based on the species. So for example, in small animals such as dogs or cats, like in dogs, the disease symptoms, especially the nervous system symptoms, the nerve symptoms, are similar to canine distemper because it usually also have the seizures, encephalitis, heat-related illness such as the heat stroke, and also on cats are usually similar to pseudorabies and thiamine deficiency. It can also be because of tick paralysis. So in tick paralysis, usually the dog will suddenly cannot move their hind legs, which is very similar to rabies. And on equines or horses, you can see that it is similar to colic, because usually in colic, the horse suddenly collapses. And also equine arboviral encephalitis and some other like septicemia. And in cattle and livestock and cows, we can see a bovine encephalitis, which also shows like the similar nervous system symptoms. and bovine spongiform encephalopathy. This is also known, if we have ever heard of mad cow disease. It was because of a prion that make holes inside the cow's brain. So all of this is the differential diagnosis of rabies. So next we will talk about how to diagnose rabies. So for rabies diagnosis, there are currently 3 most common ways. The first one is the FAT, or I like to call it FAT, which is the Fluorescent Antibody Test. The second one is the molecular testing, usually by PCR. And the last one is a rapid test, or ELISA. So on direct fluorescent antibody test, this is the gold standard for most post-mortem cases. So in this case, usually when we encounter rabies suspect cases, then they will euthanize the animal and then keep the brain intact and send the brain tissue or the fresh brainstem and cerebellum tissue into the laboratory. And then in the laboratory, this brain tissue is treated with antibodies, such as anti-rabies serum or globulin labeled with fluorescent dye. So the antibody with the fluorescent dye. If the brain tissue have the rabies antigen in it, then the antibody with the fluorescent dye and the antigen will connect. And then this antigen will be detected under the fluorescence microscope. So under the fluorescence microscope, if there are any intracytoplasmic inclusions, if there are any Negri bodies, they will show this apple green areas. So this very, very beautiful color, this green one. And then if it doesn't have the antigen, then it won't show any this apple green color. It will just show like the bottom picture here. And there are some limitations to this way of diagnosing, because the first thing is that they need fresh tissues. So if the place or your clinic is far from the reference laboratory, then it's going to be hard to ship this brain, because if the brain is rotten, then we cannot use the brain to do this FAT test anymore. The second one is that it needs a very, very expensive fluorescent microscope, which is why this test is usually only done in some reference laboratories. And because it needs to be incubated using this dye, then the result may take 1 to 3 days, which takes a long time. The second way is that the PCR, RT-PCR test. So this is more suitable for ante-mortem detection. So before the dog is euthanized, because with this PCR, it detects the virus on a molecular level. It detects it on the viral RNA of this virus. And the sample, we can use the saliva, EDTA whole blood, or cerebrospinal fluid. So because the virus, it travels around the body, so there are, we suggest to just use all 3 samples and test it individually, because we don't know in what stage the animal is. And then we can just get the result very quickly in 90 minutes. And with this Bioguard's Q-Mini, we don't only get a positive or negative result, it also shows a CT value. which is good because you can know like how far the virus has progressed. And this device is also very easy to use, and it doesn't need like any special training. And this is particularly useful, especially if you are in a rural clinic or rural areas where you need quick results and you don't have time to wait 2 to 3 days for the reference lab. But for this way, please note that usually in rabies, there is an intermittent shedding in the fluids, especially in the saliva. And it is very important to repeat this process and collect the fluid. So maybe after 2 to 3 days, you can recollect and retest it again. So last but not least is the rapid test or the ELISA. This test is very, very suitable for screening. So for example, if you are a vet and you work with like animal shelters, then you can use this rapid test to screen those dogs or those animals in the shelter. And the sample that we can use is saliva and cerebrospinal fluid. And this test, we have tested this in the lab, and we have a very, very high sensitivity, which is 96.3% versus the direct FAT, and specificity is 100% versus the direct FAT. And because the result we can just get in 10 minutes, so it's very, very quickly, very, very suitable if you need to process a lot of samples at once. And I really recommend for every clinic to at least have one of these tests ready in your clinic, because you will never know when you will encounter rabies cases in your clinic. Next is the prevention and control. So first things first, it depends on the countries or the location where you are. But I think most of the countries, when they encounter a suspected case of rabies, the vet and you must report to their local health department. The second thing is that we as vets and as government agencies, we need to promote to vaccinate not only just dogs, but also cats. And also, I think like right now there is a trend for exotic animals such as like ferrets, and then badgers, raccoons, foxes. Even I saw like some foxes. So we need to also vaccinate all of these animals against rabies. The next one is to keep pets under supervision and promote a responsible animal ownership. What does this mean is that we as animal owners, as vets, please don't let your dog roam around outside of your house, because if they roam around, they can meet other stray dogs or even meet other stray animals that have rabies. And then they can even like spread this disease to others and even to you. The next one is to manage stray populations. So like this cartoon here on the right, when I was little, when I watched those like cartoons, like for example, Tom and Jerry, I always thought, oh, this man catching the dog is such a bad man. Like, why do they catch the stray dogs? Let them live happily. But now when I am already an adult and as a vet, I realized that his job is very, very important, because by controlling the stray populations, you will decrease the number of stray dogs, number of stray cats that can possibly spread this disease. And this is also very important, not only for the animal's health, but also important for the human's health. And last but not least is the strict control of animal trafficking. So in some countries, like for example, Japan or Taiwan, they have a very, very strict control in bringing animals into their country. So for example, they will need a rabies vaccination certificate if you want to import your dog or your animal inside their areas, because they don't want to risk having animal from other countries that have this disease into their already free from rabies countries. Then, if, for example, your dog or you are bitten by a rabid animal, you can wash the bite wound as soon as possible with soap and water for around 5 minutes. So please wash it with running water, because it has been shown that it reduced the number of viral particles. And then after you wash the wound, you can put a povidone iodine or 70% alcohol on the wound. I know it will sting, but then this povidone iodine will reduce the virus further. This is an antiseptic. And then what you need to do next is that you can go and get a post-exposure prophylaxis, which is a vaccine, a rabies vaccine, and usually depends on the severity of the exposure or depends on the area where you are. You can also get an anti-rabies immunoglobulin injection, and it is usually either from a human or an equine origin. So us as vets, it is very, very important to have a pre-exposure immunization. So I see this a lot as in Indonesia, that we as vets, we need to protect ourselves for this disease, because we never know when we will be in contact with this disease, and we are the first line between this disease from the animals to humans. So it is very, very important for us vets to go and get your rabies vaccine. And also other occupations such as animal control officers or diagnostic laboratory workers, which works with this vaccine or virus. And also, for example, if you are going to travel to areas in which the canine rabies virus variant is endemic or ensootic. So next we will talk about what is a risk of exposure and what is a no risk of exposure. So you will be calm down and not panic. So a risk of exposure is an animal bite that broke the skin, and also if after it broke the skin, then if you have a wound and then the animal, like for your dog or your cat, it likes to lick you, and then it lick the fresh and open wound. Or there is a neural tissue of saliva that came into contact with a mucous membrane. So for example, like I said before, your dog or cat, they groom themselves, they lick their paws, and then came in contact to you. Next one is the direct bare skin contact with bat. As we all know that bat is a factor of this disease. And if you're not sure that a bite has occurred, because for example, you were sleeping and then when you wake up, oh, suddenly you have a bat in your room, or if you have a child that still like cannot speak, or under the medication, they're not aware of a bat, then it is a risk of exposure. Next one is that if a person receives an organ transplant from a person that gets a rabies donor. And last is if it's in a lab setting and the sample of the rabies virus has been aerosolized. And then next is what is a no risk of exposure. So it is a no risk of exposure if a person touched something that an animal has touched. For example, the dog has touched their water bowl. So, and then you touch it, it's a no risk of exposure. Or if the saliva came into contact with intact skin, so no wound, or a dry scratch, then it's no problem. So next one, if the person or animal is in the same room as the infected animal, then it is also no problem, except bats, because there are some cases about a person when they go a bat cave exploring. You know, in the cave, usually there are a lot of bats, and this person got infected because the bats can emit this disease through the aerosol. Next one is you eat something from, like for example, from a cow that is infected, you eat its meat or you drink the milk, it's no problem. When you pet the animal, it's also no problem. And if you had contact with the urine, feces, blood, or the spray, or you share, the animal share a bowl with another animal, then it's also a no problem. So next one is, you might wonder, what should you do when you encounter a rabies patient in your clinic? I'm sure like most of you, if you see a very rabid dogs, of course you feel a little bit afraid. You feel panic, even though the dog doesn't like, even just like dogs, like the dog doesn't have rabies, just a very mean dog, you will feel panic or a little bit scared. And first thing you need to do is just stay calm. Take a deep breath, stay calm, and then if you can ask for help from your veterinary technicians. And then the second thing is that please prioritize your safety. So safety first. What do you mean by safety first? Safety first means that, as I said before, please get vaccinated, because you never know when a rabies patient might come into your clinic. Second one is that you can equip yourself with this kind of like a very thick gloves. We usually call this a bite glove, because when the dog bites through this glove, like you cannot feel it. And then third one is that you can restrain the animal and then retrieve the same sample for diagnosis. So the sample might be like, for example, saliva or blood. And then while you send the sample for diagnosis, you need to quarantine the animal. So you need to put this animal inside an empty room or empty cage where it has no contact with others, and then report to the authority, report to the government. So you might wonder, what do you need to include in your report? First thing is, of course, the time of the incident, time on when the dog gets bitten, and then location where the incident occurred. This is very important, because the government needs to map out where this disease is coming from. So for example, if it's a stray dog, please, or a stray cat that bit, please also, if you can catch the animal and also bring it for testing. Third one is the species and description of the animal in case if the animal runs away. So the animal control can help find this animal. Next one is the owner of the animal and their contact information, the person exposed to the animal and their contact information. And last and most important one is the rabies vaccination status of the animal. So when you encounter the suspect rabies patient, there is this flow chart that is made by the Ohio government. So if you don't know if the dog has been vaccinated or not, or you know that you never vaccinate the animal, then it needs to be euthanized and submit the head for testing. And if there is a overdue without documentation, so you think like, oh, I'm sure that I did vaccinate them before, but I don't have the vaccination book, then there might be two cases, which is to euthanize or do a serological monitoring. So need to check their antibody titer by ELISA. And then if there is a justification exists to preserve the animal, it can get a vaccine under 96 hours of exposure, then it needs to undergo a 4-month quarantine. But if the vaccine is given over 96 hours of exposure, then the animal needs to go on a 6-month quarantine. And if your animal had vaccination before, or it's overdue, but you have a documentation, oh, when it's overdue, then the animal can just get a booster and a 45-day observation. So for rabies vaccination, it's very important to vaccinate all of the animals, and usually the first dose is given on the minimum of 3 months, because if it's less than 3 months, then it might interfere with their maternal antibody, and the maternal antibody might neutralize the vaccine. Next, we will need to give a booster. So this booster is usually given a year after the initial dose, and then after the booster, you can just give it every 1 or 3 years. So these are the list of the rabies vaccines that is licensed to use on dogs in the United States. Like there are a lot of brands. I'm sure you're also already familiar with this. And then this vaccine are all killed vaccines. And it can be given early as 3 months, and the route of inoculation can be intramuscular or subcutaneous, and the duration of immunity is around 1 to 3 years. So what about the wildlife? In some countries, like in the Europe continent and Canada, there are some efforts to also minimize the rabies virus on the wildlife. So they have been doing this administration of oral vaccines inside this so-called baits to control it, and it has been proved successful. So what they do is that they put a liquid killed vaccine inside this plastic sachet, and then usually it also have a colorant, a dye. And then this sachet is then coated with a fish meal attractant, so it smells good. And then the wild animals will come and like eat them. So these baits are usually flown like by the plane, the government will take a plane and then they will drop this from the sky above into the forest so it spreads evenly. So last but not least, from the World Organization of Animal Health, or OIA, every 9 minutes, someone dies from rabies. So even though this is a very, very 100% preventable disease, but still over 70,000 people die because of this disease every year. So please stop the disease and vaccinate not just dogs, but other animals as well. So that is the end of my presentation. Thank you for your attention, and you can follow Bioguard's social media like Facebook, LinkedIn, and also check out our website for more information of our next webinar and also our products. Thank you. So I'll give this back to you, Dr. Robert.
Yeah, thanks, Dr. Anna. You can answer the Q&A, the question from below.
Okay. So first of all, there is a question from Dr. Sanjay asking if the milk of cow bitten by dog or rabid dog can be used for human consumption after proper boiling. So as I said before, we cannot, like us humans, we cannot get the disease from the milk of the animal or even the meat of the animal. So yes, after pasteurization of the milk, we can drink the milk of the bitten cow. And then there is also other questions from Sahid Hassan Rocky. After successful rabies vaccination in dog or cat, the needle prick on the veterinarian hand accidentally before decomposing. Is there any possibility to transmit rabies? So in this case, as I said before, the rabies vaccination is usually a killed vaccine, a killed virus. So you don't need to worry if the vaccine will cause any rabies, like wild rabies symptom. Okay. Next, I will answer about a question from Eka. So in your PPT, Dr. Anastasia mentioned that the virus can be found in nervous tissue. Is the virus most commonly found in peripheral or central nervous tissue? So in this case, it depends on which stage the disease is in. If it's still on the early stage, then the most common virus, most commonly it's still on the peripheral because it takes time to go to the central nervous tissue. It needs time to multiply and go there. So if it's on the early stage, then we can use the sample from the peripheral. But then if it's already on the end stage, especially if the dog died because of this disease, then we can use the brain, the central nervous tissue. Mhm. Yes, so I don't see. Oops. Okay, there is a very good question from Ken Vicente. When is the best time to collect samples in suspected rabid dogs? So this is depending on how the situation is with the dog. So for example, if the dog already shows any nervous system symptoms, then we can of course collect the sample. But if the dog haven't shown any nervous system symptoms, then we can just do a screening. And you can also see, why is it suspected? Is it suspected because it has bitten by other dogs, or is it suspected because of a symptom? There is other question from Doc Lee. How many shots do we need veterinarians once we were bitten by a rabid or unvaccinated dogs or cats? So for this question, usually it depends on the countries and depends on the vaccine brand and vaccine dose. But usually when we get bitten, then we need to get a rabies shot, and then we can get the rabies immunoglobulin. And then it depends, and we need to take a booster vaccine. So usually around 2 weeks after that, we need to take a booster vaccine. Okay, so last but not least, there is a question from anonymous attendee. Do vaccines against rabies for humans protect against all genotypes? For example, bats. Thank you. So yes, there were some research that shown that the vaccine for humans can also protect to other serotypes. And for example, bats are a reservoir, meaning that they can get the virus, but they don't really show a symptom because they have the antibody against this virus. So thank you all for attending this seminar, and then we will share the certificate through email a week after. Thank you and see you.
And thank you, Dr. Anna, for the excellent presentation. And thank you for everyone to joining us. We hope to see you again in our next webinar. And good night.
Night.